Since the present administration came to power, the health sector has without doubt been one of the thorns in its side. The ripples of complaints from doctors and health workers, as well as strikes, went beyond the confines of the health settings, causing concern amongst the general public. Tonight, we continue with our special feature on Democracy Day, with a focus on the health sector and how the government continues to fight a heroic battle against existing and emerging diseases in the country. Our correspondent, Mary Alale Yusuf, reports.
Several infectious disease outbreaks, including, at the time, the little herd of monkeypox, were successfully tackled and overcome by federal and state governments. Noteworthy among the outbreaks is the recurring Lassa fever, which appears to have assumed a new dimension.
In the last 2 years, we now have Lassa all year round. Telling me two things. One is that the biology of the infection has changed. That is worrisome. And we're talking to some of our scientists to say, look, what are we dealing with? And in my last discussion, they claimed one type of the virus. We no longer have it. We are seeing type 2 and 3. The case fatality that used to be about 10% has moved up to about 20-25%.
The 2018 outbreak has recorded 108 deaths in confirmed cases and 10 deaths in probable cases, according to the Nigeria Center for Disease Control. Since the last reported case of wild polio virus was in August of 2016, Nigeria is looking well on her way to polio-free status in the coming year. More, however, needs to be done to spread universal health coverage, which is currently under 5%. The row over substandard equipment, unpaid remunerations and lack of staff training carried over from the former administration started up again and continue until now. But perhaps what's uppermost in the minds of hospital staff are their salary scales, discriminatory in the opinion of health workers who insist that though they might not get equal salaries to the doctors, relativity should be constant. While doctors, traditionally the head of the hospital team, accuse them of wanting to get equal salaries. There's a third argument, however, which some seem not to have considered.
In the United States, you have 3 consultants. One is a consultant obstetric and gynecologist like me. One is a consultant orthopedic surgeon. Another is a consultant neurosurgeon. Do you know that if we qualify the same day as a specialist, we're not on the same salary? The salary range for nurses is around 60,000 to about 120,000, depending on your experience, your area of specialty, and your involvement. Solidarity forever.
Moreover, players in the sector argue that increased salaries notwithstanding, quality of life is substandard. The government has held several meetings with the joint health sector unions who are currently on strike, but no satisfactory resolutions have been reached. Now that people are taking notice of the elephant in the room, which is the seeming jostle for position between doctors and health workers, perhaps the government will be better advised on how to proceed with conciliatory talks. Mary Alale Yusuf, Channels Television News.
To assess the Buhari administration's performance in the health sector, I'm now being joined live from our Abuja studio by the National President of the Nigeria Medical Association, Dr. Francis Fadoyile. I want to thank you so much indeed for joining us at this time. What changes have you seen in the health sector in the last 3 years of this current administration?
Well, thank you. We have had some significant changes. We have had the government that have done some improvement in the health. One, in terms of immunization. We have seen that the immunization level, which in 2016 was at 33%, which was abysmal low, that it has been improved with a lot of advocacy by the Nigerian Medical Association to improve it. And the strategic plan has put it to get up to 85% by 2020. Again, for those of us who are in the health sector, we were highly impressed by the Senate coming out to have the 1% consolidated sovereign fund that will be infused in for the National Health Act. And this one will boost the primary healthcare centers, which we believe will take care of over 70% of Nigerian populace. Again, this will also help in the National Health Insurance Scheme, which we believe is the way to go for financing of health. Apart from this, we want to say that the Federal Ministry of Health in the last 3 years has been able to bring up the production of vaccine in this country, and at a time we had problem with getting vaccine, and the one in Yaba in Lagos has been resuscitated, and actually the board has been set up, and I think these are things that are good. Also, we want to also say in the last 3 years the government has been able to largely contain many of these emerging and communicable diseases which have been earlier enumerated. We have Lassa fever outbreak, we have monkeypox, we have cholera, and we have meningitis.
All right, let's talk about
these are the good things.
Let's talk about some other concerns. Strikes, for instance, in the health sector have taken a huge toll on Nigerians seeking health services. What can this administration do differently, for instance, to tackle this perennial challenge of strikes?
Certainly today is not a good thing for us to be talking about strike again. But what I have seen and what has occurred over the years have shown that a government in this country has taken it headlong by having a committee of people who went outside this country. They went to different countries, both developing country and developed country, and they came out with a recommendation. That is the Yayale Ahmed panel, and they had a super recommendation. Although some of the recommendations to NMA are not very, very good, but we believe that if these recommendations are being effected, it could have helped in reducing some of these issues that are causing strike. Again, I think it is important for the government to be able to face headlong how things are done internationally. What we are having now is we have a lot of interest group coming to showcase their own interest as a professional. But we believe that the government needs to call all the professionals in the health sector to a roundtable conference. Let us sit down. Let us see how we want to move on.
Because I'm really curious also, my apologies to just butt in here, what is your association doing to address that very important issue of brain drain in the health sector?
Certainly, the brain drain that we are seeing in the health sector has a lot to do with how things are done in this country. For example, if you are saying doctors are enough in the country, we are far from the truth. Doctors are not only doctors, most health workers are overworked. And apart from that, the remunerations are not too good, and the working environment. We need to improve the working environment. The working environment includes both the machineries, the equipment, and the area. We need to have our hospital working at the optimum. We don't have this clinical governance that we need to put things in place so that we can get the best. And I must tell you, for the doctors, most of the doctors that are going out of this country are young doctors who had finished and they don't have placement. The government is not putting enough money into health, and that is why we are seriously advocating that the federal government must put its mouth where in the health sector. It has been agreed that 15% of the national budget should be allocated to health. But over the years, since it has been done in Abuja Declaration in 2001, we have never had more than 5%. And in this particular 2018, I think it is even less than 3%.
That's a good place
once you
to...
don't have money, you cannot have equipment, you cannot pay properly, and you cannot have improved health.
That's a good place to let it rest. I must sincerely thank you, Dr. Francis Fadoyile. He's the National President of the Nigerian Medical Association. Thank you so much indeed for sharing your thoughts with us here on the News at 10. Seven persons, including students, have been reported killed in a boat mishap at the Akere area of Ipokia local government area of Ogun State. The accident occurred after the boat carrying over 40 passengers, including goods, broke into two midway into the journey between Akere and Badagry in Lagos State. Survivors of the accident have been taken to the General Hospital in Ipokia, where men of the Nigeria Police Ipokia Division were seen documenting the incident and releasing victims to their relatives. Overloading by the operators of the boat has been blamed. The Cross River State government has officially launched its health insurance scheme, codenamed Ayade Care. It seeks to provide medical insurance cover at primary, secondary and tertiary levels for the old, the young, the weak, the strong and the vulnerable in the state. The scheme is also expected to cater for all kinds of medical needs of every adult and resident in the state. As the state supports for the program, Governor Ben Ayade has donated the sum of 250 million naira as seed fund for the takeoff of the scheme.
In the rural areas of Cross River State, as with most parts of Nigeria, when it comes to healthcare services, the people have to deal with inadequate and high cost of health care where available. But that worry in Cross River State is being addressed by the state governor, Professor Ben Ayade, with a health scheme the people may be able to afford.
We hope that you will align your structures and your financial systems with the National Primary Healthcare Development Agency and the National Health Insurance Scheme. We know that the Basic Healthcare Development Fund is going to be implemented this year, and that funds will come to the fund, and states like Cross River State, who are present and prepared, will be one of the first beneficiaries of the scheme.
Tagged Ayade Care, the objective is to provide medical insurance for the young and old. The project partner is the United States Agency for International Development. As the spokesperson puts it, it's all about everyone.
Universal health coverage is about equity. It's about ensuring everyone has access to care. It's about ensuring everyone has access to quality care.
What will make the project successful is financial support, and this boost is what it has received.
Cross River State government will put a seed fund to this fund, a total sum of 200 million naira.
Today we are here to celebrate, to flag off the Ayade Care, which is a free health insurance scheme for Cross River students or children. Of course, this free health insurance scheme will help the vulnerable, and you agree with me that children are even more vulnerable in the society. So this scheme works hand in hand. It's really going to help the children of Cross River State greatly in their health issues.
After the speeches, the registration process commences, with Governor Ayade and his wife becoming the first to be registered. To ensure a smooth operation of the project, 18 general hospitals and 3 referral hospitals in 3 senatorial districts of Cross River State will be incorporated into the scheme.